Yes, the pancreas is truly an indispensable organ for our survival. Today, we are going to take a closer look at this vital, yet often undervalued organ. The pancreas. Located behind the stomach, it performs essential functions for our well-being and general health. Why is it so important to keep an eye on the health of your pancreas? What unforeseen problems can result from disorders in this organ? In this video, we'll delve into the crucial functions of the pancreas, highlight signs that could indicate potential problems, and discuss foods that can help protect the health of this vital organ. First, the pancreas is key to digestion, as it produces enzymes that are released into the small intestine, allowing food to be broken down so our body can absorb essential nutrients. Without these enzymes, the digestion of proteins, fats, and carbohydrates would be seriously affected. In addition, the pancreas is essential in controlling blood sugar levels as it produces insulin, a hormone that regulates glucose in our blood. Insulin is necessary to maintain blood sugar balance and prevent conditions such as hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar. If the pancreas fails to function, serious complications can arise. Did you know that the signs of a pancreas problem may initially be mild and often take a while to detect? This is because the early symptoms of pancreatic problems are often confused with other, less serious conditions, which can delay diagnosis. Let's look at this in more depth. Pay close attention and let me know if you've experienced any of these signs. Sign 1. Abdominal pain. One of the initial symptoms we usually detect in patients with possible pancreatic problems is mild abdominal pain. This discomfort can easily be confused with common indigestion or even stress. Located in the upper abdomen, the pain often spreads to the back and intensifies after eating, especially if the food is high in fat. Patients often overlook this mild pain, attributing it to less serious causes. However, it is essential to pay attention if this pain becomes more frequent or increases in intensity. In the case of conditions such as pancreatitis, for example, abdominal pain can be a significant, albeit subtle, initial sign. In chronic situations, this pain can be a constant indication of inflammation or damage to the pancreas. My advice is to have any persistent abdominal pain checked out. It is better to be cautious and rule out more serious problems before waiting for stronger and more obvious symptoms. Another discrete but relevant symptom of pancreatic problems is digestive changes. This can manifest itself in the form of gas, bloating, a feeling of fullness in the stomach, and changes in bowel habits such as greasy or foul-smelling stools. I often see these symptoms attributed to food intolerances or irritable bowel syndrome. However, it is important to understand that the pancreas plays an essential role in digestion, especially in the breakdown of fats. When their activity is compromised, the digestive process is affected, which can lead to these changes. For example, exocrine pancreatic insufficiency, a condition in which the pancreas does not generate enough digestive enzymes, can lead to these symptoms. I recommend not ignoring constant changes in digestive patterns. Although these changes may seem normal, they could be indicative of more serious problems in the pancreas. Sign 3. Unintentional weight loss. Unexplained weight loss can be a subtle but worrying sign of complications in the pancreas. Many people initially interpret weight loss as a positive thing or associate it with changes in diet or activity levels. However, when this loss occurs without an obvious cause, it is essential to investigate further. In relation to the pancreas, this weight loss can be due to poor absorption of nutrients. If the pancreas does not produce enough enzymes, nutrients from food are not absorbed properly, which contributes to weight loss. In addition, diseases such as pancreatic cancer can lead to a significant decrease in body weight. I believe that unintentional weight loss should always be a reason to consult a doctor. It can be an early sign of pancreatic problems, especially if it is accompanied by other symptoms such as abdominal pain or digestive disorders. Fatigue is another symptom that often goes unnoticed, but can be a subtle sign of pancreatic problems. In clinical practice, many patients report feeling tired or lacking energy, although they attribute this to stress or daily routine. However, when the pancreas is involved, fatigue may reflect a metabolic imbalance, especially related to the regulation of glucose in the body. For example, diabetes, which may be the consequence of a dysfunction of the pancreas. Failure to properly regulate blood sugar levels can lead to constant fatigue. Likewise, conditions such as pancreatitis or even pancreatic cancer can cause a general feeling of malaise and exhaustion. I'd recommend paying attention to persistent fatigue, especially if it is accompanied by other symptoms such as abdominal pain, changes in appetite or weight. It may not just be fatigue, but a warning sign from the body about a deeper problem. Sign 5. Jaundice. Although jaundice, characterized by yellowing of the skin and eyes, is more visible than other symptoms, its connection to pancreatic problems is often underestimated. Sometimes, I see cases where jaundice is initially ignored or considered a minor symptom. In regards to the pancreas, jaundice can be due to a blockage in the bile duct, which is often caused by a tumor in the pancreas or by pancreatitis. This blockage prevents the bile produced in the liver from being properly eliminated, leading to a buildup of bilirubin in the blood and, consequently, jaundice. It is crucial to be on the lookout for this yellowish color in the skin and eyes. Not only is it a sign of liver disease as many believe, but it could also indicate serious problems in the pancreas. Jaundice needs immediate medical evaluation. Sign 6. Changes in stool. Changes in stool can be a subtle but important sign of pancreatic problems. Many patients don't pay enough attention to changes in the appearance of their stool, such as pale, floating, or especially smelly stools, but these can be important signs. When the pancreas is not working properly, there may be a decrease in the production of digestive enzymes, which makes it difficult to absorb fats. This causes stools to be paler, greasier, and have a stronger odor than usual. Also, in cases of bile duct obstruction caused by pancreatic problems, stools may become pale and urine darker. Don't ignore these changes. Although they may be uncomfortable to discuss, they are essential for a proper diagnosis. Variations in stool, especially when accompanied by other symptoms, should be reported to the doctor. Sign 7. Changes in appetite. A change in appetite can be a subtle sign of problems in the pancreas. In clinical practice, many patients report a reduction in appetite or aversion to certain foods, particularly high-fat foods. This symptom is often downplayed or attributed to other causes such as stress or changes in daily routine. However, in relation to the pancreas, changes in appetite may be linked to difficulties of the organ in processing nutrients, especially fats. In cases of pancreatitis, for example, eating foods rich in fat can increase pain and discomfort, which naturally leads to avoiding such foods. I suggest that persistent changes in appetite, especially if they occur along with other symptoms such as abdominal pain or weight loss, be evaluated. They may indicate early pancreatic dysfunction. Sign 8. Nausea and vomiting related to the pancreas. Although nausea and vomiting are common symptoms of a variety of conditions, they can also signal pancreatic problems. Patients with conditions affecting the pancreas, such as acute pancreatitis, often experience nausea and vomiting episodes. This is because an inflamed or irritated pancreas can directly affect the digestive system. In addition, the severe pain characteristic of pancreatic disorders may induce nausea. I recommend that if nausea and vomiting persist without a clear gastrointestinal cause, such as a viral infection, they be investigated further, especially if accompanied by abdominal pain or stool changes. Sign 9. Reduced tolerance to fatty foods. Many patients don't realize it, but a reduced tolerance to fatty foods can be a subtle sign of problems with the pancreas. These symptoms often manifest as discomfort, bloating, or diarrhea after eating high-fat foods. This intolerance occurs because the pancreas plays a crucial role in producing enzymes necessary for fat digestion. When the pancreas is dysfunctional, its ability to digest fats is reduced, which can lead to digestive symptoms. I recommend that any sudden or increasing intolerance to fats be consulted with a doctor, especially if it is accompanied by other signs such as abdominal pain or changes in stool. Taking care of the health of the pancreas is essential, and diet plays an important role in this regard. Certain foods offer specific benefits for the pancreas due to their nutritional properties. Below, we will explore some of them. 1. Green leafy vegetables. Spinach, kale, and other leafy greens are packed with essential vitamins and minerals, as well as antioxidants that can help reduce inflammation in the body, including the pancreas. 2. Red and purple fruits. Strawberries, blackberries, raspberries, and other fruits in these shades are loaded with antioxidants like anthocyanins, which protect the body's cells from damage. 3. Turmeric. This spice, known for its anti-inflammatory properties, contains curcumin, which can benefit pancreatic health. 4. Omega-3 rich fish. Salmon, sardines, and trout are excellent sources of omega-3 fatty acids known for their anti-inflammatory effects. 5. Whole grains. Foods like quinoa, brown rice, and oats are high in fiber, which aids digestion and helps maintain healthy blood sugar levels. 6. Legumes and beans, high in fiber and low in fat. Legumes and beans benefit the health of the pancreas, aiding in both digestion and blood sugar regulation. 7. Garlic and onion. With their antioxidant and anti-inflammatory properties, garlic and onion can provide protection to the pancreas. 8. Yogurt with live cultures. Yogurts with probiotics or live cultures contribute to a healthy balance in the digestive system, which benefits the pancreas. 9. Low glycemic fruits. Fruits such as apples, pears, and cherries have a low glycemic index, helping to keep blood sugar levels stable. 10. Green tea, rich in antioxidants. Green tea may reduce the risk of inflammation and certain types of cancer, including pancreatic cancer. It is essential to remember that a balanced diet, including fruits, vegetables, whole grains, and lean proteins, along with a healthy lifestyle, is essential to keep the pancreas and the body in general in good condition. Avoiding excess alcohol and high-fat foods, especially saturated and trans fats, is also key to pancreatic health. As always, regular medical checkups and health screenings are vital to maintaining overall health and preventing disease. I suggest you pick up one of these videos and keep moving forward on your path to a healthier life.